Dr. Lyon, if you would advance the slide to your biography slide. Our presentation tonight will last for approximately 1 hour and will be presented by urologist Dr. Mark Lyon of Associated Urological Specialists. Dr. Lyon attended the University of Chicago for medical school and residency before completing his fellowship at Austin Hospital in Melbourne, Australia. Dr. Lyon, thanks so much for giving us your time tonight, and I'll turn it over to you now. Make sure to unmute yourself before you get going.
Hello, hi, I'm Dr. Mark Lyon. I'm a board certified urologist. I work at Associated Urological Specialists in Evergreen Park. I've been a Southsider my entire life. I was born here and grew up out here on the Southwest side, and spent most of my schooling and training in Chicago and on the South side. Went to undergraduate at the University of Chicago and also medical school at the University of Chicago. Actually just had my 20th year reunion, which is starting to make me feel old now that I've had a 20-year reunion for medical school just this past June. And I did my residency also at the University of Chicago in urologic surgery. I completed special training in minimally invasive urology at the Austin Hospital in Melbourne, Australia, following my urologic residency at the University of Chicago, and came back here to my native southwest side of the city here in the suburbs. So glad to be able to take care of people out here and be back to my roots. So tonight we'll cover an overview of the prostate. We'll also talk about BPH and treatment options. We'll start with just talking about the prostate. The prostate's a gland that most people don't even know exists or know about until they're older and it starts giving them problems. It's a walnut-sized gland that sits at the base of the bladder. It essentially forms the first part of the urethra. So it forms the pipe that we urinate out of. It produces fluid that supports the sperm and transports during ejaculation. The prostate grows to its normal adult size in a man's early 20s, and it begins to grow again during the mid-40s for most men. And it continues to grow throughout a man's life and is one of the only glands that will continue to grow throughout the lifetime. And that's why we ultimately do run into problems with the prostate, because it forms that pipe that the urine passes through, and it will continue to grow. As it grows into that pipe and starts to block up the pipe that urine passes through when we urinate. What sort of things can happen to the prostate? Well, there are multiple different conditions that can affect the prostate, and each of these conditions affects the prostate a bit differently. There's the enlarged prostate or benign prostatic hyperplasia. There's also prostatitis, which can be an infection or inflammation of the prostate, and there's also prostate cancer. We'll first start with an overview of BPH. What is BPH? BPH is enlargement of the prostate, meaning the gland of the prostate has grown larger than normal. The normal adult size is about 1.5 inches. Benign prostatic hyperplasia is benign, then non-cancerous. Prostatic means relating to the prostate gland, and hyperplasia means enlargement or more cells than normal. Benign prostatic hyperplasia can lead to bladder outlet obstruction, and that's essentially the prostate enlarges, and by doing that, it's closing off the pipe that you're urinating out of, and that obstructs the outflow of the bladder. This can lead to what we call lower urinary tract symptoms, or LUTs. Does BPH mean that I have prostate cancer? No. BPH's relation to prostate cancer. BPH is not prostate cancer. BPH does not cause prostate cancer. Enlargement of the prostate is a normal thing that happens as we age. BPH symptoms can be similar to prostate cancer, though. And BPH can coexist, meaning that you can have prostate cancer and enlargement of the prostate at the same time. Prostate-specific antigens, which is a blood test to test for prostate cancer, cannot alone distinguish between benign prostatic hyperplasia and prostate cancer. Both BPH and prostate cancer can cause elevated levels of PSA. Normal versus the enlarged prostate. As the prostate enlarges, it essentially can close off that urethra. The urethra is the tube that the urine passes through on its way out of the body. You can see from this diagram here that the prostate sits just below the bladder. And so the prostate is the first part of the pipe where the urine exits. As we get older, the prostate continues to enlarge. And as it enlarges, it can obstruct that pipe. As it obstructs that pipe, the bladder starts to try and work harder and harder to try and keep the urine flow up. And that the body is sort of adapting to these changes as we age. And so sometimes these can progress in ways that men don't even realize how bad things have gotten and how much they're sort of beating up their bladder by forcing their bladder to work much harder and pump much harder to get the urine out of that closed off channel because the body is so adaptable. But the crux to the problem is that the pipe is getting clogged up by the enlargement of the prostate. Now, there's a point on here that prostate size does not necessarily correlate with the degree of obstruction or severity of symptoms. What are the symptoms of BPH? Well, mainly we have frequent urination. And each one of these symptoms, doesn't mean if you have one or don't have one of these that you don't have BPH. You can have one of these and not have all of these. And so, but a lot of times we'll get commonly the complaint of, well, I'm just going to the bathroom more frequently than I used to. And usually that'll get someone to come into the office where they realize that they're going to need to have this addressed. They start to go more frequently during the day. They start to go more frequently at night. They may notice that their stream, though they have a weak urine flow, they may also have sudden urges to urinate or a sensation that the bladder doesn't empty or that the urine flow may start or stop. All of these can be signs or symptoms of an enlarging prostate. And a lot of times guys can progress to the point where they just shut off and have an inability to urinate. A lot of times men won't address these. A lot of times they'll be brought in with their wife or by their wife, and the wife says, "Oh man, he's going all the time." And the husband says, "No, I'm not going that much." And the wife says, "What do you mean? We can't drive anywhere without you having to, get us to pull over to go to the, find a bathroom here or there. And you're getting up all night to go." And the husband says, "Yeah, I guess you're right." And then they start a discussion of addressing this. But sometimes these symptoms can be very severe, and sometimes they're really, they're really difficult for the man that's experiencing them to really notice. And they think that this is just what they call getting old. So a lot of the time I hear men complaining of, frequency, these urges, the, leaking urine, having trouble getting their urine stream started. And they say, well, They tell me, well, that's not a problem, doc. It's just that I'm getting old. And I think that's probably the most unfortunate part is that it is a problem, and it's a problem that's affecting the body, and it's a problem that's really causing trouble for the bladder. And most of all, it's an issue that we really have great options to take care of, and we really can help with this. And so these are things that, yes, it is going to happen as there's progression of age, but really this is something that we can address and we can fix. And it doesn't have to progress. It doesn't have to, men don't have to deal with these symptoms. We can help, and we can help in a lot of excellent ways. So, and that's, really these symptoms are such that they can really affect men's quality of life. And, I can't tell you how many times I've seen, men where they come in and they say, I'm urinating fine. And when I go to examine them, they may even be to the point where they're wearing diapers, and they say, "Oh, doc, I just leak a bit. I'm just getting old." And then I'm able to dive a little bit more into it. And what they're really having trouble with is they're having trouble with BPH and the enlargement of the prostate affecting their bladder and causing them trouble. And that's a shame, because we can get to it long before that point. And the earlier we get to it, the easier it is for us to solve and fix, and that they don't have to suffer with these symptoms. And these are symptoms that really do affect the quality of life. And this slide just goes over a bit of that. So who can get BPH? Well, any man with a prostate can get BPH. But BPH is the most common prostate problem for men that are over 50. So by the time men are 60, about 50% of men are affected by BPH. And that by the time men reach 85, 90% of men are going to be affected by this. And so it's really something that almost every one of us men will face some point during our life. And these are progressive changes that continue on. And they're changes that we can address, and we have a lot of very safe, easy, and effective ways to address. And so it's not something that people just have to deal with. And it's not something that should be assumed to be just the cost of aging. These are problems that are associated with aging, but problems that we can fix, and then problems that really I enjoy fixing. And so, how is an enlarged prostate diagnosed? Well, the first step is to get an appointment with your urologist, and that we're gonna do a history and physical exam, and part of that physical exam is an examination of the prostate, and we'll examine the prostate for the size and shape, and help to also make sure that we don't feel anything abnormal that feels suspicious for prostate cancer or something like that. We also may do urinary testing to test the pressures and the flow of the bladder. And also, crucially, we'll make sure that the body is not retaining too much urine. And that's really a big issue, because, not only is this a quality of life issue, but as the prostate grows and blocks up the pipe, it can cause the bladder to hold on to too much urine. And as that progresses over time, that can lead to basically the urine backing up, causing problems for the kidneys and that sort of thing. And that's a shame when that can be avoided. And so certainly I want to always get to it before guys get into trouble with their kidneys and cause trouble there, so that these are things that will, on a routine urology evaluation for this, will be tested. We also use some questionnaires to evaluate the symptoms of BPH. And these are self-evaluation questionnaires. There's the AUA symptom score or the International Prostate Symptom Score. And these are really the most commonly used. And these are a set of questions that help us assess the severity of symptoms that you're having. This brings us into treatment options. So what can we do about these problems, and how do we treat this? Well, we want to treat according to the severity. And there are a lot of very easy things that can be done, and some that don't even require medications or any treatments of any kind. There's sometimes where just simple behavioral modification can be made, such as changing the diet, changing the fluids, restricting caffeine, and bladder training, and what we call watchful waiting, where a man may have very minimal symptoms and not such a big problem, and that we decide together with that man to just follow along and watch how things are going. And I think that the most important thing is the education, and that men oftentimes don't know exactly what's going on, and they certainly a lot of times don't know the options of what they have in terms of treating this. And I think that really knowing what's going on and how this is going to change and possibly progress throughout your lifetime is really very important, and especially at this early stage, where even making behavioral modifications can help. But I think the most important part is the education at that stage. And so really I try and educate men about what's going on, why this is happening, what's the trajectory that may occur over a lifetime for this, so that as they progress, they can know what's going on, and they can help themselves to get care, to get treatment when needed, and also stay out of trouble, most importantly. And so that's really key, especially early on. As people progress, they may need other therapies, and you'll see some of the first line therapies here listed, including oral medications, transurethral thermal therapy of the prostate, the Rezum, or implantation to sort of help open up the channel of the prostate. But really, they're excellent therapies that we have, and that sometimes people need more. They need actual surgical procedures, and that there's laser, where we can go in and basically vaporize the tissue with the laser, or with the laser, or the prostate, or even sort of core out the inside of the prostate with the laser, so that we open up the channel. There's transurethral resection of the prostate, which is a traditional method that's been used for decades to basically shave out the inside of the prostate. And there's also prostatectomy, which is sort of removal of the prostate gland through the abdomen. And that those are obviously more invasive and more aggressive things. And that I certainly hope to get to patients before they get to that point of needing something that requires general anesthesia and hospitalization. And there are a lot of ways to do that. People oftentimes will ask about alternative medicines, and that just from the AUA, their statement is basically no dietary supplement, combination of phytotherapeutic agent, or other non-conventional therapy is recommended for the management of lower urinary tract symptoms secondary to benign prostatic hypertrophy. This includes sapometo and urticariadosa. So what is watchful waiting? And this is sort of the early stage here. And we touched on it a little bit, but watchful waiting may involve just lifestyle modification, adjusting your diet, restricting fluids before bedtime, adjusting other medications that you may be on, or even exercise patterns. Obviously, this is as minimally invasive as you can get in terms of there's not much here besides changing your lifestyle to improve your urinary habits. And this is obviously meant for someone that's very early in the stage of having an enlarged prostate with minimal symptoms. The real thing to remember here is that as you age, this is likely going to change and is likely going to progress. And so, how long that's going to take and when that's going to happen, that's impossible for us to know. But as you saw from some of the earlier slides, as we get older, with 90% of the people that are 85 or older having this problem, it's almost a guarantee that it's going to, and that we're going to get there if we live long enough. So what are some of the medications that we use? Well, we use what's called alpha blockers sometimes. These are medications, oral medications, that help relax the muscles in the bladder and the prostate, allowing the urine to flow easier. And these do help, and they are effective. And so there are a lot of times when people may be interested in starting medications. As with any other medication, they do carry side effects. They can affect the blood pressure, and they can affect the blood pressure significantly. They can cause even dizziness or fainting spells and or fatigue. We oftentimes will even encourage patients to take these at night before they go to bed, so that fatigue doesn't bother them so much. But that still can be bothersome despite us trying to sort of manipulate when the medication is taken. And obviously any drug can have interactions with other drugs, and that becomes more and more of a problem as people age and as other medications are added in. As people age, they tend to get the medications piled on, blood pressure medications, cholesterol medications. And so all these kind of can combine together to cause more symptoms and issues. There are also medications that shrink the prostate. They're called 5-alpha reductase inhibitors. And these basically can help stop the growth of the prostate or even shrink the prostate by manipulating some of the hormones within the prostate. They also do have side effects, including erectile dysfunction, lowered sexual drive. They can have ejaculatory dysfunction and breast enlargement. And so, these are things that when you really review the things they can cause, people aren't interested in being on this type of medication and for a long time. There are certainly men that this is an excellent medication for, and there's certainly men that do very well on this medication, and there are men that I use this medication for. But I think everyone's got a little bit different setup and what's going to work well for them. And a lot of that depends on their medical issues. A lot of it depends on their lifestyle. A lot of it depends on their prostate, where they are on the scale of problems. But the medications definitely have a role. But for myself, I wouldn't want to be stuck on a medication for the rest of my life for something that really has very safe and effective treatment options. And some of these are such that you don't even need a catheter, or in that these that are done right here in the office just with a scope. So my philosophy is, why would you want to be on a medication for something, and possibly even a lifelong medication, when we have so many excellent treatment options that can fix this problem and basically maintain your bladder health, and really, rather than covering it up with medications or treating it with medications, we can fix this, and we can fix this safely and easily with minimal to no side effects. So how do we do these treatments, and what do we do? Well, there's Rezum, which is basically a water vapor therapy, and that's where we use a scope to treat the prostate, and that uses basically the natural energy that's stored in water vapor steam to treat this excess prostate tissue that's blocking up that channel. And this is one of these newer minimally invasive therapies that can be done in the office. This is done in the office with just local anesthesia, and possibly sometimes even just a little inhaled anesthesia, a little nitrous oxide, laughing gas, to help you to be more comfortable. But it's done through the scope. It's done in the office, and really can get excellent results in a minimally invasive way to treat that blockage. And so these things are really a game changer, these minimally invasive treatment options, because you can go from a point in time where things used to be mainly where people were given medications to treat this problem. But now that we have these newer therapies that are so safe and easy and effective, that it really changes the paradigm of how the enlarged prostate and the symptoms are treated. There isn't the need to spend a lifetime on these medications, because your risk of having trouble from these procedures has gone down so significantly with these new minimally invasive treatment options. Certainly, they still have risks to them. Okay, like anything else, you can have bleeding or even a urinary tract infection, and that the post-operative period, meaning right after the procedure's done, there's going to be inflammation, and so the patients for a while are going to feel like they need to pee more frequently, or may even have some pain with urination while they're healing up from the treatment. And this is to be expected. We're going to give you a video here on, if we can get our video working, to see the Rezum and how it works.
Rezum water vapor therapy is a non-surgical treatment for BPH. Rezum uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Rezum is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Rezum therapy lets you quickly return to normal activities. Talk to your doctor about Rezum if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
Okay, so essentially the Rezum, you can see here, this is a diagram of what patients with BPH are dealing with. So we've got the bladder up here, and that right down at the base of the bladder is the prostate. Hopefully you can see my arrow there. But essentially that prostate is growing into and impinging the channel or the pipe that the urine passes through. And that's what ultimately causes a lot of the problems that we have with BPH and then the bladder outlet obstruction, blockage of the outflow of the bladder. And so that the idea is to get rid of this tissue here, and the prostate opens up back to more of its natural previous state when it wasn't so enlarged and when a patient was younger, and that they can then urinate much easier, better flow, less frequency, less urgency. The bladder doesn't have to work so darn hard to try and get that flow out. Instead of them having, a pipe that's shut off, the pipe is opened up, and it's much then easier to urinate, and those symptoms get much better. And not only that, but these different treatments allow us to basically help the bladder and save the bladder from decades of having to overwork and to accommodate for that closed off channel. Because when that channel's closed off, the bladder, which is your pump, has to work so much harder to be able to pass the urine. And that in turn makes the bladder much thicker and more muscular, and so really can beat up your pump, or your pump, which is the bladder there. Okay, we're going to go ahead and play a little video. This is just a patient testimonial and experience with Rezum for you.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Rezum when I was researching enlarged prostate and the procedures to repair it, to fix it. And Rezum was one of them. The more I researched Rezum,
Sorry about that, everybody.
it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Rezum procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Rezum procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezum treatment has made a very big difference in our life.
Okay, you see there that they're in their studies, 97% of the patients would recommend to a friend. So, the people really do quite well with this. There are other treatments that are also minimally invasive, such as prostatic urethral lift. And this is basically lifting up and opening up that channel of the prostate to move that tissue out of the way and open up the channel so that, again, the urine will flow better, the bladder doesn't have to work so hard, and that this also may have potential side effects, but again, is a very safe, easy, effective procedure that really is also one of the game changers of minimally invasive urology. Here's the green light laser, and this is laser therapy to vaporize away the prostate tissue. Another way of opening up the channel of the prostate to make that outflow better, to make the urinary symptoms better. As we're sort of moving along, the green light laser does require general anesthesia. And we're moving along in terms of the treatment options here, and that we're into treatment options that do require more invasive procedures, and that it also includes transurethral resection of the prostate. And this basically, we're using electrocautery to shave out the inside of the prostate with transurethral resection of the prostate. And it's another very good procedure that works very well, and that is sort of the gold standard for treating the prostate over the last number of decades. But this does have more aggressiveness in terms of the level of needing general anesthesia, requiring hospital stay. These are done in the hospital, and that the patient will need to stay over a few days in the hospital, and can have significant side effects from the procedure. But it is still a very good procedure, and still used commonly to treat BPH. Prostatectomy. Sometimes when we do have very large prostates, that some of these other procedures are really not appropriate for, because the prostate has really gotten massive, that we'll even do procedures that require us going in through the abdomen and basically opening up the prostate and coring out the inside of the prostate that is enlarged. This is certainly more invasive procedure, and with the level of invasiveness going up, so does the potential side effects. But this is a procedure that is required sometimes when the disease process has progressed along far enough where other ones just really aren't an option. And so that this is an effective procedure for the right prostate, and for when other ones aren't effective. Obviously, we always try and use what's the safest, easiest, and most effective. And now we really do have excellent options for that are very safe, easy, and effective. Some of these options, have no risk of sexual dysfunction, no risk, where we don't even need a catheter. These minimally invasive therapies don't have the risk of incontinence, meaning leakage of urine, which I think is one of the main things that men worry about. When I start to talk to men about having treatment for the enlarged prostate, they oftentimes will talk about someone that they knew, either a relative or a grandfather or that sort of thing, and they'll talk about, oh, what happened to them. And usually these are things that are 20, 30 years in the past at least, and in that the treatments for the prostate have changed so much that really it's a massive paradigm shift in taking care of this problem. And it doesn't have to be something that's going to be a problem for that man throughout its life. And that I can't stress enough that this is something that it's easier on the patient. They have easier options for them the earlier they get this addressed. And that I think men carry so much fear, unfortunately, about addressing this, that they really are very hesitant. And that's a shame, because we can help, and there are a lot of great things that we can do. And not only can we help them be in better shape now, but we can help them be in better shape 10 years from now, 20 years from now, and they don't have to live with it. And so, we've covered a fair amount about the prostate and about BPH. Hopefully people understand, what the prostate is now and how it works and what it does, and how the enlarged prostate is BPH. We've covered treatment options from the simplest of watchful waiting to minimally invasive first-line therapies, such as, medical therapies, oral medications, water vapor therapy, prostate lifts. And we've also covered more invasive surgical procedures that, such as laser therapy of the prostate, transurethral resection of the prostate, or prostatectomy. These are very different treatment options. People will a lot of times bring up, a neighbor that had treatment for prostate cancer and what happened to them. The treatments that we have for BPH are very different than the treatments for prostate cancer. And what someone had for prostate cancer and how they ended up urinating has no association with how people end up with treatment for BPH, meaning when the prostate is treated for benign prostatic hypertrophy. So these are very different things. And so what can be the next steps? Well, consultation with a urologist and someone that's familiar with these therapies and has a whole armamentarium of minimally invasive and invasive therapies to use. There are times where minimally invasive is just not the right way and that more invasive surgery is needed. But the important part is that these are things that can be treated, and they have safe and effective treatment options. And that really, I love taking care of this because I know I can help men and I know I can change their life for the better. And so that's what really excites us as physicians, is being able to take people's problems and put them behind them and make them as small as possible and get them moved on with their life. And that's what we're here for. And that's what we want to help with. And that, we realize that there's a lot that goes along with these problems, from the fear of having to address it on men's parts, and they also just the feeling that, well, it's, why bother with this? I'm just getting older. These are a lot of things that people face, and that it doesn't have to be that way. That we're here to help, and we're very eager and happy to help. So come on in and let us get these things addressed for you. We can fix them. We're at the point of the discussion where we're happy to take questions, happy to address any issues. And so we'll leave it open for questions, and they'll help me with the questions now.